What is the project title?
The project title today is Utilization of Resources to Improve the Clinical Effectiveness, and it is being done by the physiotherapist specifically.
Why did you undertake this project?
The reason for this was mainly because the travel time was a main issue that we were struggling with seeing every patient in Newry and Moan area. The time of travelling, the distance of travelling, the coverage area of Newry, the complexity of cases takes longer with one case. Sometimes it could be more than 45 minutes to 1 hour. And then again the distance is more worse. Staffing level in the skill mix was the next problem to us. The staffing level is just one physio for the whole physical disability team covering the whole of this area. It is going to be much harder. Skill meds, yes, we do not have anybody at present, even though we are being given with a band 5 temporary at the moment. Now the stress that we take with the complexity, with the staffing level, with the pressure, with the distance of travel is too high to see a patient. The waiting list was getting worse and worse because of our travelling distance and because of the waiting time to see a patient. And that was giving a delay of the patient waiting for longer and longer in our waiting list. And the space compromising, even at home, whatever the type of the home, we do not have enough space to do a rehab. Even though you would find it okay for an assessment, to do any rehabilitation, we need to bring them into a centre. So space was a big issue to get into any homes. Weather could change every day, and sometimes I could end up with an accident, or the patient not well, or there could be a natural calamity. So we always found there should be a solution for what should we do to utilize the proper resources that we have closer to us.
What were the aims of this project?
The main aims were to improve the waiting list. That was the main priority. As you all know, everyone is in the pressure of statistics. So the pressure was mainly onto the waiting list, to improve the waiting list and not to get any patient going to the breaching area. And the second was to decrease the duration of the review and the initial appointment. See, at present we have got a waiting list of an urgent should be seen within 5 to 10 days and a non-urgent should be seen within 3 to 6 months, 3 to 6 weeks. So that is going to be a wee bit more better if we are able to bring the time management a bit more better. So this was the main priority that we had. And at the same time, we were going to think about some resources that is going to improve our clinical effectiveness or the management of the patient much better. The second is patient satisfaction. Patient could be more satisfied if they are seen in the best place, in a better environment, more earlier than waiting for a longer time. Standard outcomes. Most of the homes cannot be made. You cannot do the standard outcomes in every house. You need to have a controlled environment in some of the standard outcomes. Controlled treatment to be progressed to uncontrolled environment. I believe in most of the cases, even with a fall or the patient who has got a recurrent or relapsing MS, in our case of physical disability, I feel initially they need a controlled treatment in a controlled environment to be progressed to an uncontrolled environment, that is to their home basis.
Did you face any challenges, and if so, how did you overcome them?
We did face challenges. We knew that there were some resources available just to the next door. Yes, we did have. Unfortunately, they were belonging to a different area of learning disability. Even though we knew that there was a therapy room which was lovely, which was fantastic, which had all the equipments that we needed for treating a patient. And we had lots of dialogues, lots of talks in the high-level management talks. And I know our managers would have worked very hard to get at least one space. So we have got at least one day, half a day, being allotted to the physical disability to use in that resource. We would think that we would need more of this, and this would have improved our facilities again. At the same time, we do still have an issue about the timing, because at present the physio of this area is on maternity leave, and I'm covering as 2 days only in this area. And the timing that we have got at the moment is just half a day, which I'm not here. So probably we would be having a wee bit more dialogues, and we would wish that they give some more time, and which would improve and cover the challenges again.
What were the results of the project, and how's the service users experience?
Yes, and my colleague has already done a very good booklet about this whole thing, and she has found the results fantastically great, and she has been working with that centre with the specific allotted time that's been given to her. Claire has worked fantastically well with them. And we have found from the patient management, they have found that there's an improved waiting list duration. That means the duration of waiting is being reduced if you're going to use a day centre rather than going home. And we can give them early reviews and appointments rather than we unable to give them an early review, we are able to give them early review. We can see them every 1 week if needed to be seen. And again, the outcomes can be improved with minimal sessions. We don't have to go for many sessions at home to see them 5 to 6 sessions. Even with 2 to 3 sessions, we are able to give it good outcomes. And we are also able to give them a self-management program as they are improving. Now, from the clinician point of view, it is improving the clinician availability, because we are available most of the time because we're very close to our office, so we are available all the time. And this is reducing the traveling time, which in turn is always helping us to think about the patient management rather than traveling and the distance of traveling. And from the trust point of view, I believe it is also helping your expenditure rather than spending lots of money in we claiming for our travel, rather than the patients coming to us and we helping them out.
Thank you.